Good morning, Dr. Rosenberg.
Yes, good morning.
How do I know if I have allergies or maybe just a cold?
Well, it's mostly based on timing. A cold will only last for a short period of time, maybe 7 to 10 days, whereas allergies will come and go, and they will last for like a whole season, months at a time.
So what kind of symptoms would I get if I have allergies?
Well, there's actually a lot of different symptoms that you may have. They could be watery, itchy eyes, a runny nose, thick mucus in your nose. Sometimes GI problems will occur with allergies. The allergies that we usually treat are the ones that usually cause the nasal congestion and runny nose, watery eyes, that type of thing.
So how do I know what triggers my allergies?
Well, the only way we could really tell what triggers it for sure is to test you. We do a skin test here at the office that will determine exactly what you're allergic to and how much you're allergic to those things.
And I've noticed that my allergies are worse in the summer. Why is that?
Well, it depends upon, again, what you're allergic to. There's things that are more prevalent in the summertime, like flowers and trees. Whereas things like mold tend to be all year round.
And I live part of the year up north, so why is it when I come to Florida my allergies are worse?
Well, you're just allergic to things that are here in Florida. In Florida we tend to have more mold, we have more trees, more grasses that people are allergic to. So those things, those grasses or trees might not be up north.
And why is it I have allergies now when I've never had them in my life before?
You have to be exposed to things to become allergic to them. Sometimes people will live in an environment and never become allergic to it. Once they've lived in an environment long enough to go through the seasons to get sensitized to the different things, that's when they become allergic. For instance, like a child, a baby, is not going to be allergic because they've never been exposed to anything.
So will my allergies ever go away?
If you either change your environment, usually if people do that, they usually have a 1 to 2 year grace period, and where they can become resensitized, maybe. The other way to get rid of your allergies is to become desensitized, and that's where we give you either shots or sublingual therapy to give you immunity to the things that you're allergic to.
So are either one of those better than the other? Are allergy shots or drops better?
Well, the end result is the same as far as sublingual therapy or shots. Shots usually take a little bit longer because we only give them once a week versus the sublingual, where we give them every day. Sublingual therapy is more convenient because you don't have to go to the doctor's office. You can just give it to yourself. The shots are usually better covered by insurance, but to be honest with you, it's actually a wash as far as convenience and deductibles and things like that. It's actually fairly close as far as expenses go. But again, the end result is the same.